Hello, everyone. Welcome to FormFest 2024. My name is Kelly Henderson. My pronouns are she, her, and I'm the Government User Research Program Specialist with the Digital Service Network at the Beck Center for Social Impact Innovation at Georgetown University. You can learn more about our work in the link that's shared in the chat. Feel free to say hello in the chat with your name and where you're joining us from. We'll plan to use the Q&A function for your questions, which you can find on the right side of the screen. Please add them as you think of them, and I will ask them aloud for our speakers and the recording during the Q&A portion at the end of the session. We're going to dive right into our session. Our speakers will introduce themselves briefly, and you can also check them out in their full bios by clicking on their speaker profiles. We also encourage you to connect with them on LinkedIn. So each presenter group will have about 25 minutes to present, leaving us with about 10 minutes at the end for questions. Again, welcome to FormFest, and I'll turn it over to you, Sahoko, Jamie, Sheetul, and Felecia.
Hi, thanks for joining us today. Today my co-presenters and I are going to talk about the key learnings, from the Maryland Benefits pilot application. How making a pilot application can transform digital benefits. First, I'll start with introductions. I'm Sahoko. I'm a qualitative researcher here at Code for America. Basically, I talk to people to understand how and why they do things, and then work with a cross-disciplinary team to put those learnings into actionable changes. One of my colleagues is here today, Jamie, who I'll hand it off to next.
Hi, so my name is Jamie Renee Williams. She, her pronouns are great. I'm a staff UX designer at Code for America. For anybody who doesn't know what a UX designer does, I try to translate research into actual screens that are usable for clients and caseworkers and things like that. So I do a lot of listening, and I do a lot of sort of like the hybrid work between research and the technical side. So I will pass it over to Sheetul and let her introduce herself.
Thanks, Jamie. Hi, my name is Sheetul Agrawal. I'm the Chief Product Officer for MD Think with the state of Maryland. I lead all our digital products, solutions, and platform we build at MD Think for the state and our agencies at Maryland. Felecia?
Thank you so much. Good afternoon. My name is Felecia Billingsley, and I work for the Baltimore County Department of Social Services as the Assistant Director. I oversee all cash programs, medical assistance, SNAP, and also the OHEP program. Thank you.
Thank you.
All right. So that would be me. So one of the goals that we have at MD Think is to simplify and significantly improve the experience of the services and solutions that our customers interact with that we build, especially following the human-centered design. Benefits application experience is a key area. A lot of our benefits customer interact with that, and we, in partnership with the Department of Human Services, Code for America, and MD Think, decided to focus on that particular piece of work for the pilot. Next slide. The online benefits application on MD Think today has a lot of opportunity for improvement. It's not very customer friendly. It is complex and does not render well on mobile devices. Research shows and data shows that most of our customers, for them, the mobile device is the primary device. So we really need to cater to that requirement. We also believe that a simplified experience would lead to increased usage of digital application, save time for the customers ultimately, and improve enrollment and the timeliness of the enrollment for the customers. And to achieve these goals of simplification and making things easy for our customers, Code for America was looped in with their experience in human-centered design and also previous experiences with benefits application to help us kind of redesign the digital benefit applications that we have on the MD Think portal today. So I'll now pass to Sahoko and Jamie to talk more about the pilot.
Thank you, Sheetul. And building on what Sheetul was saying, according to a Code for America study that was conducted in 2023 that evaluated the landscape of public benefits enrollment across the U.S., The MyMD Thing application took about 70 minutes. For context, takes longer than 9 out of the 12 states that had similar integrated benefits applications, which is what you see in the chart to the right. So as Sheetul mentioned, Code for America Maryland saw this really great opportunity to work together to create a simple, caring, and transparent experience for people applying for benefits. And as part of that partnership, Code for America committed to using our depth of knowledge about human-centered design to empower the team in Maryland. And to just give you a little preview, we went from this, which is a design from the current customer dashboard. What you might notice is there's a lot of information on this page, which is great, but the call to action is a little bit unclear. Also, it doesn't have a whole lot of information about how to actually apply for benefits. And this was designed to work best on a laptop or a desktop computer, didn't really adapt well to mobile screen. As Sheetul mentioned. And as Amanda mentioned in the keynote earlier, many people actually don't have access to desktop or laptop computers, and Marylanders are no exception. This 2021 report showed that about half of low-income households in Maryland actually don't have access to a desktop or laptop. So with that in mind, we went from this design to the pilot, which is this, a mobile first design, meaning we prioritize the needs of mobile devices. There's clear call to actions, options based on user needs, there's benefits recommendations, guidance using plain language about the process, and ability to add things like income and expense with ease. The pilot that we ran was for 3 months, from April to June in 2 counties in Maryland, Baltimore and Queen Anne's County. And for those of you who are familiar, one is very large, one is quite small, and that was very intentional on our part. And the pilot covered SNAP and cash programs and OPEB categorical eligibility, which is the new program that started earlier this year. And I'm going to hand it off to Jamie to talk about pilots.
So I'm going to talk a little bit about what we're going to talk about today. So the first thing we're going to talk about is why even do a pilot. And then the next thing we're going to talk about is sort of like what was our approach and what was the process like. We have some shared stories we're going to give you guys, and then we're going to talk a bit about the impact that it had and what that means for the future in Maryland. So we can go to the next slide. So first question is, why do a pilot? This is a really important question. I think the first thing to think about when doing a pilot, it's a very low risk building block. It's a great way to scale down, some of the programs and scope to really focus in and learn a lot. I think the other thing is probably, I kind of wish I'd made this the first choice, but the second thing I think is important, it helps build trust. So one of the things I think that Sheetul mentioned, and we were hearing from caseworkers, we were hearing from clients, is that the application was extremely hard to do online. It was very stressful, and we believed people. So a lot of the work that we did in addition to actually making a pilot was a lot of listening. We did a lot of research. We had sessions with clients and we had sessions with caseworkers and also people who were making policy and really concerned about implementation of the rules to really gather information from them. And then the last thing I think that's really important and may seem obvious, but it's not always the case, especially when you're working with government. It gave us the space we needed to address gaps to learn and iterate upon the designs. And we'll show you some examples of what we're talking about in a bit. But we can go to the next slide. I'm going to talk a little bit about what our approach and the process was like. So in the next slide, please. So there were a couple places where we saw some opportunities. We initially did the equivalent of like a heuristics of the site. We sort of looked at everything as was. We did some initial research with caseworkers, and there were a couple things that stuck out to us. The first thing that stuck out to us, I think, that we realized is we had a really good opportunity to heal and rebuild trust with the people we were working with. And the way that we identified that we could do this was by simplifying the experience and also being a little bit more trauma informed in terms of the language that we were using and the way that the whole thing was designed. So we leaned really hard into things that were, like plain language best practices, using permission-based language. We like to use the Hemingway app here at Code for America. It really helps us ground it into the right grade and the right framing. The second thing that we really noticed was an opportunity was to make the pilot application more concise and transparent. So it was unclear what to do, why to do it, and what it was going to lead to. And there was a lot of sort of jargon. So we realized that less time somebody needs to spend understanding the application, and the more time they have to sort of properly answer questions, and the quality of those questions is gonna make for a better time for caseworkers who are processing them. And then the last thing was about data. So we wanted to make sure that we were only collecting the information we needed that was it was timely when it happened, and it was relevant. So only asking questions when you needed to ask questions for the people who are applying, not for everyone, and making it relevant to things like the programs that people were applying to and what stage they were at of applying. So those are some of the main things that we tried to focus on. Our approach on the next slide, which I'll talk a little bit about, in terms of thinking about the design, was obviously wanted to do a collaborative approach, and we also wanted to do something that was going to be an iterative design. So I don't know if you're familiar, but we were using sort of a model that's loosely based off of the double diamond method. And this is you sort of use a discovery phase, you do a definition of what the problem is, you make a design around that, you test that design, and then you go back out and you see if it's working and make adjustments based on that. So it's kind of a bit of a loop, but then in this world, it's more of a diamond. So that's kind of like what we were thinking as we were heading into doing the pilot. And Sahoko is going to talk a little bit next about what it was like with our relationships.
Thanks, Jamie. Like Jamie mentioned, one of our main takeaways was that relationships were really key to our success. And it was those relationships with stakeholders, clients, and caseworkers. And to build those relationships, we started with one of our core values at Code for America, which is listening first. We know that we don't have all the answers, so we listen carefully and try our best to understand and meet people where they are today. So the way that we did this was that we met with stakeholders early, before the pilot even started, when we first started this partnership, which was last June. And all these stakeholders that we met with had varying roles, responsibilities, and availability in the project, but we knew it was really valuable to get their perspective. So we met with them however we could, virtually, one-on-one calls, sometimes in person. It was a lot of one-on-one calls. In addition to meeting with them one-on-one, we also hosted in-person workshops, and I want to highlight those because they were absolutely critical for us to learn and align on goals and ways forward to make improvements to the application. And it not only helped build relationships with stakeholders, but stakeholders with each other too. The stakeholders had an opportunity to be in a room with others who are working towards the same overarching goal, and connect with people they either didn't know or really know that well. And then after we launched the pilot, we continued to update stakeholders by sending email updates, attending their regular meetings and sharing updates, and also checking in with them one-on-one when needed too. We also tagged and linked with clients too, before the pilot to learn and understand their experience with the application in the context that they're situated in. Like Jamie mentioned, this is a really stressful time for many clients, so we wanted to understand how we can help to make that experience just a little bit less stressful. Then after we launched the pilot, we continued to get feedback through surveys. And then the relationship with case managers was also key. We gathered lots of feedback through about the current experience and then also different design ideas that we were exploring as we were designing the pilot. Some of the ways that we did this was, again, through workshops. You can tell we love those. And then brainstorming sessions using virtual whiteboards like Miro, where we shared some of the design ideas from very early design stages to more high fidelity ones later on. Then after we launched the pilot, we felt it was really important to continue to get feedback from case managers because they were the ones actually on the ground processing the applications, interacting with the clients. And we knew that they could provide us insight into the experience and what's working and what's not. And as Jamie mentioned, this is part of the beauty of the pilot. The small scale really allowed us to address gaps quickly and iterate on our learnings. And some of the ways that we did this was getting feedback through the pilot, was through like anonymous comment boards such as AZ Retro, weekly meetings with case managers and supervisors. We also conducted interviews, surveys, created work logs to ensure we captured the caseworker experience. We were so committed to getting feedback from county offices that over the period of 3 months, we actually changed the way we gathered feedback 3 times. And on that, I'm going to hand it over to Felecia, who can speak a little bit about her experience in this partnership. Felecia?
Absolutely, thank you. As it is shared here, I was a little hesitant. I really had some challenges with doing a pilot, but honestly, as they've shared, building trust was very, very important. And as such, I was pleasantly surprised that this would be such a great pilot after initiating it day one. So prior to initiating the pilot, we actually got to test the software and actually completed an application, I should say, submitting an application within 18 minutes. So I was sold basically, and so was my staff. So thank you. So as you can see here, what we did was exceptional, and we really appreciated the Code for America, the pilot, and so forth. They valued our input. They made changes as soon as we said, things that weren't working, they basically supported it with new iterations regarding the tool. So I think that was very, very helpful that our input was valued. And yes, it was a simple tool. What we were used to as opposed to what we had with the two was phenomenal. We had a tool that relatively cut the application down to, I'd say 5 pages as opposed to 20. So this was a pleasant surprise for all of us. And the clients really appreciated the document. They basically said, is that all there is when they completed the application?
Thank you, Felecia.
You're welcome.
Yeah, thank you so much, Felecia. I love hearing that kind of stuff. I mean, because I do the design stuff and I just look at a screen all day, but I always have to keep in the back of my mind there's like actual people. And when I hear that, when I would hear that every week from the caseworkers, it was always like very like humbling and like warm, maybe feel warm inside. So I'm going to talk a little bit about the iterative research and design. I'm going to show you some of the tools that we use really quickly in case you're wondering how we sort of like did this. We can go to the next slide. One of the things that's at the core of a lot of the ways that I like to work and what I like to start with is like defining who are the people and what are some of the needs and the abilities they have coming into things. And a persona spectrum is a really great tool. If you're not familiar with it, I would Google it. There's a whole nice book on it. And it's a great way to sort of build in some of maybe accessibility needs, whether those are sensory needs or cognitive needs, but also social needs, people's fears around the process of dealing with government, especially when government maybe hasn't been the most helpful or maybe has caused harm to them. And then also it's a great way to establish sort of a use case and scope down what the pilot is going to be. We can go to the next slide. I'll show you a little bit of the way that we were able to manage the scope of the pilot. So we created some user flows. We did pretty top level, like bird's eye view of the total client journey. And each one of those little colored sections that you see there is actually one of the possible different flows that somebody could encounter if they were applying for benefits. And if you go to the next screen, you'll see that we actually only focused on one. And so that's the real benefit of doing the pilot in terms of low risk is like, we're only going to affect this part of the application. Everything else is going to stay the same. And that was really helpful for us being able to do it in a short amount of time, get stuff out, make changes and keep going. So the next thing I'm going to talk about actually is how do you bridge the gap between getting the designs to look at a certain level and a certain quality, but also implementing kind of best practices around accessibility and things like that. One of the big tools in our toolkit was using a design system. The design system that we have at Code for America is a hybrid between our own internal design system and also the US web design system, which is publicly available. So actually you could go and Google this right now if you wanted to, and you would have access actually to components and like how to use it and best patterns for design and UX sort of best practices. But the next thing I want to talk about is actually a learning story. So a bridge between what Felecia is saying was a great experience and actually an example of how we learned to implement feedback. So one of the things we had to do because we were only focusing the pilot on a certain area was figure out how we were going to sort of triage people to either go to the current application that already exists right now in Maryland on MyMD Think, or to kind of be filtered through our pilot. And one of the things that we did here was that we we basically got some feedback after we released the screen from caseworkers that people were feeling confused and scared. And we learned that what we needed to do was actually split this out and give a little bit more context. And that was really helpful for making and alleviating some of the stress that people felt. So I'm going to pass it really quickly to Sahoko, who's going to talk about the impact that we managed to pull off before we talk about next steps.
Thanks, Jamie. So we did all this work and now wanting to talk about how it landed for clients and case managers. One of our goals was to reduce the time spent completing the application. And if you recall, the benefits enrollment guide study found that it took 70 minutes to complete the current application. And we tracked the average time spent completing the pilot application and found that the average time to completion was 18 minutes, which was really exciting for us to see. And we're also really happy to see that we had a high completion rate of 85%. So those are people who started the application, 85% of them finished it. And then we asked clients what their experience was like throughout, and we have some quotes here to share. One was awesome and very easy to complete. This next one's my favorite. After an in-person interview, a client just submitted their application and they said, you know that saying too good to be true? It's like that. Are you sure I'm applying for food stamps? And my favorite is now the hearing from the caseworkers too. So I'm going to hand it over to Felecia to talk a little bit about their experience. Oh, Felecia, I think you're on mute.
My apologies. I just want to share real quickly. Initially, we only had the pilot in one location. Because it was so successful, we expanded the pilot to 2 of our largest locations. And what the staff really found out that they spend a lot less time supporting the clients. We basically used the QR code in one of our locations that really didn't have as much support as the office that we initially ran the pilot. The QR code was instrumental in clients accessing the QR code with their phone, and not only submitting the application, but also submitting their documents as well. So it really took a lot of less time and effort from my staff as far as supporting a client in the lab, where they're basically assisting them with an application for about 70 minutes or more, depending on, their skill set in terms of applying. So that is where our staff spent a lot less time supporting the applications for clients. Next.
Thank you so much, Felecia. We really enjoyed working with you. It was great. And now I'm going to hand it off over to Sheetul to talk about what's next.
Right. Thanks, Sahoko. Yeah, so we were very excited to see the outcomes from the pilot, all the learnings and the designs that came out for the benefits application. And now we are actively working to bring the pilot application to MDThink portal in partnership with the DHS, Code for America. We will be bringing the application to multiple programs, including SNAP, CASH, and our energy programs. So those are our next steps. We looking to launch sometime next year, and very excited for this partnership. Further, Jamie.
Perfect timing. We have 1 minute left. I just want to say, here's some information on how to reach us with questions. I know we have a Q&A session coming up, but I did just want to say thank you for all the people who have participated in this partnership, including the Department of Human Services, the Family Investment Administration, my MDThink and my MDThink team, our county partners at Queen Anne's and Baltimore County, any of the community-based organizations were super helpful, and all the numerous clients that we reached out to. I think at Code for America, we've had nothing but we've really enjoyed the impact and the outcome of this. I know we had some ups and downs and people had to sort of work through things, but I think that's part of the process. So I'm really excited for where we're going in the future. And I know we have another group coming up next, but we're happy to answer all your questions later in the Q&A session. Thank you for having us.
Thank you.
Great. Thank you all so much. It was a very thoughtful presentation and can't wait to dive into questions after the next presentation. So just as a reminder to take your questions to the Q&A on the right-hand side of the event platform. And now we're going to hand it over to Stephanie and Blair.
Hi, everyone. Thank you so much for being here with us today. And we are really excited to share our perspective on evaluating form modifications at scale. And I think the organizers did a really nice job of pairing us with the past presentation. And hopefully there are a lot of learnings you all can gather from looking at how our different methods of approaching these kinds of evaluations can complement each other. My name is Stephanie Tepper, and I'm an associate evaluator at the Office of Evaluation Sciences. I come from an academic background in social psychology, and at OES, I work to design and implement evaluations focused on economic opportunity, small business, and safety net programs. And I'll be presenting with my colleague, Blair Reed, who is a portfolio lead at OES. Blair comes from a background in political science, and she leads a portfolio at OES focused on technology modernization, infrastructure and rural development, and customer experience. And the goal of our session today is to provide you with some knowledge and tools regarding how to evaluate whether a change to a form or a benefits application is actually working for people and having the desired impact. We'll do this by sharing our process and learnings from an evaluation that we conducted in partnership with Code for America as well. And the focus of that evaluation was to improve the income reporting process in the SNAP application. But to begin, we'd like to introduce you to our organization, the Office of Evaluation Sciences. We're based in the federal government in the U.S. General Services Administration in their Office of Government-Wide Policy. OES is a team of interdisciplinary experts that works across the federal government to help agencies build and use evidence. And over the last 10 years that we've been around, OES has been partnering with federal agencies to answer priority questions using rigorous evaluation methods and existing administrative data. To do this, we design and conduct impact evaluations of programs and evidence-based program changes, and we conduct descriptive studies as well. And to date, we've completed over 130 collaborations, including over 100 evaluations with dozens of agency partners. And across all of the evaluations we've conducted, we've reached a total sample size of over 75 million individuals. So OES works to serve federal agency priorities, and with that, we've conducted a number of evaluations related to federal forms. In these evaluations, we aimed to improve the customer experience of individuals accessing government services and to reduce administrative burden for individuals and the staff delivering these programs. Across these evaluations, we've learned a lot about how to conduct impact evaluations of government programs and the forms and applications that people use to access these programs. So we are excited to share more about our process for doing so in this talk today, and we'll point you to some other examples from across our work as well. Just to get everyone on the same page, at OES, we typically use randomized evaluations to measure whether changes to forms or programs are effective. And we want to give you just a brief overview of this method in case it's not something you use in your work. You may hear it referred to as randomized evaluation, a randomized control trial, an experiment, or an A/B test. So as an example here, let's say that we have a typical form, Form A, and then we have a version of that form that we think is new and improved, Form B. If we want to know whether that improvement leads more people to complete the form, one way we could do that is by randomly assigning individuals to be sent either Form A or Form B. What this does is it creates comparable groups that really only differ in terms of which version of the form they received. So if we then statistically compare the completion rates between these groups, and we see that people who received Form B were more likely to complete the form, we can be really confident that this difference in the completion rates was caused by the improvement we made to this form. And this is what allows us to make causal claims about whether an improvement to a form is really working for people at scale. In our session, we want to share some of our work on evaluating form improvements at scale, and we're going to do this by discussing one evaluation of a form improvement that we conducted in partnership with Code for America and USDA on the SNAP application. So this study focused on evaluating form modifications embedded in Code for America's digital assister for the SNAP application in one state. We'll return to this evaluation throughout the talk as we share how we integrated usability research and randomized evaluation to design and evaluate improvements that were aimed at making it easier for SNAP applicants to report their income in the application. And then at the end of the talk, we'll also discuss some other related evaluations that OES has conducted, and we'll conclude with some ideas for how agencies can use randomized evaluation to determine whether changes to forms are effective at scale. So this particular evaluation began with a focus on a specific population. Our partners at Code for America shared, based on their own statistical analysis, that SNAP applicants who had to report income from multiple jobs were significantly less likely to submit the SNAP application in their digital assister. So this trend from existing data suggested that applicants who had income from multiple jobs or multiple sources might be facing unique barriers in completing this form. In the typical digital assister, the way it usually works is that applicants are asked to enter their total household income in a single text box. But for applicants with multiple jobs in their household, this might be more challenging. So they might struggle to add up income across different sources and different pay schedules. And this could lead them to abandon the application at that stage, resulting in this lower completion rate and meaning that those people are less likely to actually receive benefits that they might be eligible for. So given this pattern in the data, we decided that the focus of this evaluation would be on making it easier for SNAP applicants who have multiple jobs to report their income, thinking that there might be some unique design change that we could make to help that population specifically. So to try to address this, we worked with CFA to design an alternative income reporting process that added more structure. So this was designed to help walk applicants through entering their income step by step. CFA also carried out usability testing during the process of designing this new income reporting process. So they were able to iteratively change the design of the process based on user feedback to try to make it as effective as possible. Our evaluation ran from June 6th to August 15th of 2024, and it included all SNAP applicants in the digital assister who made it to the income reporting module and who reported having more than one job. So everyone who made it to this stage in the application was randomly assigned to one of two income reporting options. There was one group of people who were asked to report their total household income for the last 30 days in a single text box, and that was sort of the business as usual, unstructured reporting condition. And then we had this new structured reporting condition where applicants were asked to report the income from each job for each earner in their household one at a time. So in a household with, say, two earners who each have two jobs, the applicants would start with one earner, enter the income from each of that person's jobs, and do the same for the second earner. And for each job, it was also sort of broken down into smaller steps. So applicants would select the pay frequency and enter the amount that that person earned per pay period for that job. So really the goal of this was to take this more complex task of entering your total income in a single box and trying to break it down into more manageable components where people are more likely to know the answer to those questions. And applicants who were assigned to the structured condition did also have the option to simply estimate their income instead if they preferred not to have to go job by job and earner by earner. So in terms of what we measured in this evaluation, CFA collects all responses to the SNAP Digital Assister, of course, along with indicators of which condition people saw, whether they saw the unstructured or structured condition, and then whether they ultimately submitted their application. So the primary outcome that we were interested in here was whether they ultimately submitted the SNAP application and whether there were differences between these groups and their likelihood of submitting it. So now I'll show you the findings. On average, we saw that across both conditions, around 58% of applicants who entered the income module ultimately did submit the application. You can see in the graph here on the right, so the blue bar represents the percentage of people who completed the application in the unstructured group versus the red bar showing the structured group. Application submission rates were actually slightly lower in the structured reporting condition, but this was not a statistically significant difference. So what this means is that on average, adding structure to the income reporting process did not necessarily help applicants complete the application. So this was contrary to what we expected, given that we designed this to try to increase application submission. In addition to looking at application submission, we also compared these groups on other metrics, and we found some interesting patterns worth sharing. So as an example, we found that applicants who were assigned to this structured income reporting condition reported more income on average. So this means that something about the process of breaking down the income questions into smaller components actually led people to report higher income. These applicants in the structured condition were also about 3 percentage points more likely to report income that was over the threshold for SNAP eligibility that was set by the digital assister. So this could mean that these people were less likely to actually be eligible for SNAP. But due to data availability and the time frame of this evaluation, we weren't able to link this to SNAP approval outcome data. We hope to be able to do that with additional data soon and follow up to see, really importantly, whether this actually led to changes in people's likelihood of being approved for SNAP. Another finding was that even though submission rates did not differ across the whole sample of applicants, there were some subgroups of applicants that actually were impacted by these different conditions. So among applicants with only one household member, compared to those with multiple household members, those in the structured condition were less likely to submit the application than those in the unstructured condition. And this was not the case for applicants with multiple household members. So what this means is that the structured flow might have actually made the process harder for people who were applying on their own behalf instead of on behalf of themselves and other household members. And we actually found a similar pattern in terms of whether people applied on a mobile device or a desktop. So applicants who applied on a mobile device were less likely to submit the application when they were assigned to this structured condition, but this was not the case for applicants who applied on a desktop. So again, this reveals some useful information about the potential hassle of having to go through a more structured income reporting process on a mobile device. So now that we've told you about this evaluation and our findings, we wanted to zoom in on the process and specifically what we see as the merits of combining usability testing and randomized evaluation in a single project. Many organizations rely on qualitative data and user testing to design improvements to their forms. These methods are extremely useful, but we also want to highlight the added value of conducting evaluations at scale, as we think this is an important tool we can use to understand how broader populations of form users are impacted by the changes we make to forms. So in our collaboration with Code for America, we begin with this trend that was observed from analyzing baseline data. And this was that people with multiple jobs are significantly less likely to complete the form. So analyzing baseline data that form administrators likely already have access to is a really nice way to identify where there are barriers in the form from a more quantitative angle. For example, you could look at common drop-off points on a digital form, or look at whether different subgroups of people are differentially likely to submit the form. And these kinds of patterns in the data can help you identify barriers in a form and areas where you might want to focus on making improvements. Next, we worked to come up with new user experiences to reduce burdens and barriers in the application process. This can involve activities like reviewing prior research, applying evidence-based insights and visual design principles, and more. So in this particular case, we reviewed existing literature on how people enter their income in forms. We also conducted a landscape scan of existing federal forms to understand how they ask people about their income. And we saw that different forms really use a range of different structures for income questions. So this is the stage where you can also start to generate hypotheses on how a given improvement to a form might make the user experience better or might help eligible beneficiaries complete the form. Next, CFA led a usability testing process to generate feedback on the design and look for areas of improvement. So this is where they recruited sample applicants and asked them questions as they went through this newly designed flow. This process can really help you understand how people are engaging with a new design for a form and can help you identify further areas for refining and improving the form. And finally, we measured impact using a randomized evaluation. So as we've showed you, this involved randomly assigning applicants to either use the new form or the original form, and then measuring whether outcomes differ between these groups. For example, whether people who use the new form might be more likely or less likely to submit the form. We want to use this case study to highlight how different research processes can be integrated into a single project to gather really rich data. So usability testing and other kinds of qualitative research can really help us learn how people interact with the form and can provide insights into possible improvements to the overall user experience. Evaluation methods like randomized evaluations or other types of research designs can tell us about impact. So, do the changes we made to a form affect submission rates on average across the whole population? And these processes provide different types of information that together they can be powerful tools for understanding how to improve customer experience. So with that, I'm going to hand it off to my colleague Blair to talk about different ways of measuring whether changes to forms are working for people.
Great, thanks, Stephanie. So the different research activities that Stephanie just mentioned rely on and generate different types of data. And these different types of data are how you can think about measuring if your form improvements actually worked. A lot of the data that we care about when it comes to forms is about the customer experience, how people feel about the forms and their perceptions of how difficult the form was to complete. We also care about a lot of different other types of outcomes. Figuring out the right outcome to measure whether your improvements worked at scale requires clarity on which outcomes you care the most about and the right data to capture those outcomes. Did the improvements work is a really big question, and it has many different component puzzle pieces and many different ways to think about how to answer this. On this slide, we'll outline different elements that you might care about when defining whether your improvement works, what data sources you might draw on, and provide some examples of those different types of data. So one piece of the puzzle and one source of this data can be looking at how people actually navigated the form. This can be collected during usability testing, but it can also be collected at scale to be used as an outcome in an impact evaluation through things like paradata on digital forms. For example, looking at how long it takes a user to complete a specific page. Some of the metrics that we'll talk about you can collect in both digital and paper forms, but some of them you can only collect in digital forms. Paradata, for example, is something that you would only be able to collect at scale in digital forms. Next, we might also care about how people feel about the experience of using the form. Depending on how you think about it, this might be the closest to what we mean when we all talk about the customer experience. This type of data can come from things like usability testing and semi or unstructured conversations with individuals as they complete a form, and surveys can also help capture these important perceptions. Another piece of the puzzle relates to how people use the form to actually apply for benefits. For example, we can use the form to look at priority outcomes, such as whether or not people actually submitted the form, which is of course what it takes to get them in the queue to be evaluated for benefits eligibility. We can also use this to collect data on who the form users are. For example, their age, race and ethnicity, gender, to the extent that a form asks these questions. We can use the data generated by these demographic fields to see if different types of people have different experiences, or if different types of people respond to a change in the form differently. For example, in the study with CFA that Stephanie described, we saw that applicants who had one person in the household versus multiple people had lower submission rates in the structured condition. We were able to conduct this analysis because the form already collected information on the number of people in the household. So we could look at differences based on this demographic variable in terms of how people responded to the change in the form. Finally, we probably want to know what happens to these people once they actually applied for benefits. Here we can use programmatic administrative data such as approval or denial rates to understand whether changes to the form actually helped people get access to benefits or helped county workers process applications more quickly, detect fraud, or other important outcomes on the administration side. So moving on to the next slide, I want to just think a little bit about some considerations in measuring if your improvement worked. All the measures on the previous slide are important, but they all capture slightly, or in some cases, very different things. In different studies, you might care a lot about a different combination of these outcomes. Practical constraints can also dictate the decisions of which outcome you choose. You may only be able to capture some outcomes, particularly if you're studying changes to a paper form. There are some important considerations to think through as well when you're selecting these outcomes. For example, are there metrics that have been used in other similar studies or across other forms that can help you benchmark what you're seeing in your data? At the end of the day, though, we often care about more than one outcome, and it can be really tricky to piece together different outcomes and do a cohesive story with a simple answer to the question of, did this form improvement that we just fielded work? So while we're concluding the presentation, on the next slide, we just wanted to get you thinking a little bit more about how you typically measure whether a form improvement worked. What question or questions are most important to you in measuring form improvements? The answers to these questions and how you would think about prioritizing these research questions when you care about several of them can help you think through what metrics to focus on, since different metrics tap into different aspects of the applicant's experience. Hopefully this question can help you start to think about what type of data you have in your forms and what you could use in future evaluations of form modifications at scale. So moving on to the next slide, hopefully this talk helped to not only highlight the importance of randomized evaluations to understand the effectiveness of form improvements, but also help to explore how at-scale evaluations complement other forms of research and data collection, like qualitative user testing. Before concluding, we wanted to highlight a few other examples of impact evaluations to learn about forms and form burden in the federal context. We'll then wrap up with some big picture takeaways as we all continue this work. So putting all these pieces together can be really tricky to think about how to do this with sort of live real-time form modifications that you're fielding. But it also underscores the importance of thinking about how to evaluate changes to forms at scale. So let's just return briefly to our example of the form modifications for households with multiple jobs that we did with CFA. In this evaluation, we saw that people reported liking the new structured version of the application quite a lot when they went through it. Yet at scale, this did not actually translate to more people submitting the application. This is a really important finding that we would not have been able to uncover without a large-scale impact evaluation. Future studies could collect some other different types of data, like we discussed earlier, for example, survey measures of people's experience and perceived ease completing the versions, to get to the bottom of whether applicants liked the structured version of the application better than the unstructured version at scale. And finally, figuring out how to randomize versions of a form that people are actually responding to can be really challenging, particularly in a federal setting, which is typically where Stephanie and I work. While evaluations can be challenging to set up, there are lots of different avenues and opportunities for how we can use them to study the impact of changes to forms. As in our evaluation with CFA, federal agencies can partner with organizations who host digital versions of the forms, or community organizations who might have the capability to use multiple versions of a form and randomize which applicants see a new versus old version of the form. There may be also opportunities to encourage program administrators, such as states or localities who administer federal programs, to adopt changes to a form. And finally, we can also consider evaluation designs that do not involve random assignment, such as evaluating the effects of a change to a form through a phased or staggered rollout. So moving on to our next slide, we just wanted to quickly share some other OES studies that take very different approaches to learning about the impact of form modifications or form burden. Even though these are all impact evaluations, these studies adopt different approaches to learning about form improvements and form burdens. You can find all of these studies on our website or follow up with Stephanie and me if you would like more information. So first, OES conducted another evaluation of form modifications in collaboration with CFA on their digital assister. This evaluation followed a similar approach to the one that Stephanie talked about, but focused instead on households who only had a single source of income across earners or across an individual. Breaking up your user base into segments, here single income households versus multiple income households, can allow you to design and test modifications that are targeted at particular customer journeys or experiences. In another project, OES looked at the impact of a type of streamlined income verification, a fact-based proxy, to see if applications were more likely to be approved when you alleviate the form burden of uploading income documents. This evaluation took a different approach entirely. Instead of understanding how a form modification can impact outcomes, we instead looked at how removing a form-based barrier can make it easier for applicants to access programs for which they are eligible. In yet another approach, OES actually created its own model form and fielded 2 different versions of the form and asked members of the public to complete the model form. Each version featured a slightly different setup, and this approach worked really well for trying to understand the effectiveness of 2 different solutions to a very common challenge in form design that could then be applied across the federal context. Finally, OAS has had experience modifying a live federal form in the field, working with an office at GSA to compare two different flows of a form and looking at how outcomes differed. All of these studies took very different approaches to understanding the impact of forms at scale, sort of highlighting the diversity of the space of impact evaluation on forms. So that's about it for us. On the next slide, we just have a quick question for you all to think about. What is the biggest barrier to conducting a randomized evaluation or A/B test to form improvements at scale for your organization? And we are really looking forward to hearing your questions and reflections in the Q&A. And thank you so much for joining our session.
Great. Thank you so much. Two wonderful presentations, a lot of range of ideas and thoughts that were shared, and really grateful to hear from both teams here. Now we're going to switch over to the Q&A portion, and we'd love for you to go to the Q&A section and add a question or upvote. Be sure to vote. We want to be able to kind of make sure we get to the top questions, and then we'll dive into that. So I'll take a look at the questions, but feel free to add and continue to vote. Getting started, maybe we'll start with the Maryland team for now. Can Maryland's team talk more about some of the post-implementation challenges that occurred with the Maryland Think SNAP and how the state navigated those challenges?
So if you're taking it, yeah, go ahead.
Yeah, thanks, Sheetul. I could speak a little bit about this, and other people, if you want to add to this, please feel free to. In terms of post-implementation, a few things come to mind are getting access to the data about determinations, because we were working with a system that didn't allow us to see, we saw the application, but not how they were processed and then determined afterwards, because there's usually like a 30 or 60-day process. So that took a little bit of time. And then also, like was mentioned during the presentation, just being able to get regular feedback from case managers was something that we took several steps in different ways to navigate to get. But we would say actually, once the project got started, it started to go pretty well. We would say that more of the challenges came in pre-implementation and working up to the pilot. I'm wondering if anyone else would like to add to that.
Yeah, I think thinking about like the design and engineering in terms of literal implementation, I think we had a process in place that just sort of flowed throughout the whole thing. So I think we were doing bi-weekly releases of some kind, and we were doing design grooming with engineers. And so there was a place where we could take what we were learning from case managers and immediately sort of like work through in like a 2 to 3 week sprint to actually like implement things. So it made it a little easier to sort of do it incrementally rather than all sort of like at one time. So I think after we had launched, we still had that structure in place, and so we could make quick follow changes, and some stuff we actually decided we weren't going to do in the initial launch, and we ended up doing those right immediately afterwards as well. So it was kind of structured around being very nimble.
Great. Thank you so much for answering that question. We'll bring it over to Stephanie and Blair. There's a question. Can you briefly share the back end of this process in terms of software, data privacy, and analytics, i.e. drop-off rates?
Sure, I can answer that. And then Stephanie, if you'd like to jump in with anything that I missed. So some of the back end we unfortunately can't speak to because CFA is the one who manages the digital assister and sort of sets up all of the workflows for getting the data from the forms. But what we can speak to is sort of what happens when we get the data. And essentially, CFA uses a secure transfer to get the data from the form itself over to us. And when we received it, we received data from everyone who completed the application and was eligible for the evaluation during this time period. From a sort of data privacy perspective, all of this is anonymized before it gets into our hands. So we don't actually have access to any of the personally identifying information from here, and we're really just working off data on how users are completing the forms. So from there, we look at responses to the patterns on forms, responses to the questions, and use that to create our outcome measures. For example, if we're looking at drop-off, we would look to see how many people made it to page 1, how many people made it to page 2, how many people made it to page 3. And then if you're dropping off, eventually we would just get missing data for the folks who didn't make it that far. And that allows us to calculate a particular metric, for example, of all the people who started the section of the form, how many of them dropped off when it got to the point of asking about their income, how many dropped off when it got to a point of asking about household structure, how many made it through the end. And we can use those analytics to really build a story about how people are navigating these forms.
Great. Thank you very much there. So I'm going to pass it back over to the Maryland team. This question got a number of votes. The person asked, you said you changed the way you gathered feedback 3 times during the course of the project. Any tips or shortcuts you learned from that process?
Jamie, I see you laughing too, because this was a lot. Yeah, we had changed the way that we gathered feedback, as in at first we created a work log, which was like a spreadsheet, which had a number of columns and asked people to fill those in. Then we switched to a survey, then changed to another type of survey. What I would say, if there's tips or shortcuts that we learn, have multiple ways of gathering feedback ready to go. And also the other thing is because we tried to gather feedback from multiple offices, those offices had different things that worked for them. And so one thing that was a little bit challenging was because we changed the way that we gathered feedback pretty quickly, we were able to get the consistent we were able to get the same variables, but they were just slightly different. So we just had to make sure to do some like checking with the case managers in the offices to make sure that the data that we were comparing with one office to another, for example, was consistent. And I would say the other thing is also, if you have the time and resources, check in with the people individually. That was one of the strengths of building the trust with the case managers, was we were starting to have these relationships with some of these supervisors, case managers. Felecia, you're an example of this. We pinged you so many times. Thank you for that. And so we were able to just check in and be like, hey, can you tell us a little bit more about this, which was incredibly helpful.
Great. Thank you very much. And we'll do one last question over to Stephanie and Blair, if you can answer this one in about a minute or so. The question is, what sorts of policy or regulations govern A/B testing? Any challenges there?
Yeah, I can get started on this, recognizing that I am not the expert. So it's always good to check in with people who are the experts, especially on the Paperwork Reduction Act, PRA. I think that's really the big thing that comes up when people are thinking about whether you can do this. There was some recent guidance that came out around like what usability testing activities are allowed under PRA without having to go through a lengthy approval process. It is challenging with having live forms in the field, and some of the ideas that we put out around like using these digital assister type forms or using quasi-experimental methods. There are a lot of tools that are available that are allowed under those regulations. And then there are other cases where you may need to seek out particular permissions to be able to go through that process. Blair, is there anything else you want to add to that?
Not in a minute. I think that PRA is kind of really the big one that we're grappling with in the federal context. But yeah, I think there are lots of sort of creative ways to do the sort of impact evaluation that we're talking about that can work alongside some of the PRA requirements and restrictions that Stephanie mentioned.
Great. Thank you all so much. And thank you to the audience for all the great questions you shared. I want to give our speakers a round of applause. Thank you, speakers, for sharing such great work that you've been doing. Next up, we have our instant networking until 3:45 p.m. Eastern. Then there'll be the closing keynotes on the main stage. So with that, we're going to end the stream, but thank you all so much. Thank you to our speakers, and thank you all for joining.